My name is Stella Murumba, a health reporter. So we are here with Dr. Rono and Dr. Andrew, the minds behind the PEAK innovation, PEAK technology. That is the portable eye examination kit that is used to examine any eye conditions in children and also adults. So they will tell us when exactly they launched the project, what they intend to do in the next 3 years, and how the project will be rolled out in the entire country.
Yeah, thank you very much. As you've heard, my name is Dr. Rono. Yeah, an ophthalmologist based in Kitale, but I cover Transzoia County, West Pokot counties, and the Turkana counties. So I'm in charge of 2.5 million people. Yeah, in that county, we do have, we anticipate that about 80% of the people have eye problems, suffer from blindness that could be treated. Let's go in terms of numbers. Blindness in that region is about 0.5%. That's for every 1,000 people, we actually have 5 people who are blind. And the cause of those blindness is actually conditions that we could actually treat or manage. I've been there for the last 10 years. And the first time I used to go from one county to another, going to communities, bringing them up, bringing people up. We also had children as well who have similar problems. And it is actually painful because I cannot move from one county to another. I mean, it's better if I'm in a place and all these people come in. So when we were still going out and doing outreach, all those people, then this idea of PEAK came up. And I can say, yeah, it could actually help me in terms of, reducing the amount of time I'll spend in the villages, in communities. So the first phase was a pilot, which was covering 50 schools in Transzoia. So in those 50 schools, we were able to screen 21,000 children. Out of that, we found 900 who are visually impaired and were referred to hospital. In Transzoia, there are 400 primary schools with a total population of about 300,000 children. So our target is to reach the 300,000 children in the next 3 years. Yes. And subsequently now we will hope by that time, and this willingness actually from the county government to take up and do now routine screening. And so that any new people who come in are just screened. Of the 900 that we referred to hospital, about 400 eventually came to hospital, and those advanced we treated. Technology itself does not treat people. It's basically, we use the technology to invite people to the hospitals. And it is upon you to decide whether you want to go or not. Yeah. But more often than not, it is like when I send you an SMS, please come to Kilimani Primary for this event. It's upon you to decide whether you're going to go or not. So that's what basically technology is linking up people, and it tells them, okay, Dr. Rono will be available in Kitale on Tuesday. Please arrange your timetable so that it's available at that time. That's the technology that can do it. But for the country, when they are willing to support and they have the capacity to do it, then the apps will be free for all that. Yeah. So this time, it's a new technology. And just like M-Pesa, it began in Nairobi. It went to Mombasa, and then it went to all the other towns. It spread slowly. And then you learn new things as you move on. When everybody will be ready, then bang, they just take it.
So now it's only effective in Transzoia?
Yes, at the moment in Kenya, that's the birthplace, and it's now being nurtured there.
But I don't think we'll wait, it won't be that we'll wait the 3 years of the program in Transzoia. Once we have an effective running program in Transzoia, we can then start in parallel to begin it in lots of different counties. And certainly, I envisage Rono getting even busier, going and sharing his know-how in terms of setting up the program in neighbouring counties in parallel. The program has been designed to be applicable in any health system, and Kenya was the birthplace, and now Transzoia is the first place where it's going to be scaled across a whole county. And now we're getting interested in doing it in other countries, and I've just returned from Botswana where there's interest to take the same program and roll it out there. In terms of seeing it move across Kenya, then certainly we are willing. We just have to wait for there to be the time and the desire and the funding to do it. But this is why we do what we do. So our plan is to eventually see every child in Kenya having the opportunity to be screened. The only question is when.
Okay, and how long does it take to train someone to use the application, or it's self-taught?
It's basically very simple. If you know how to use an Android phone, the other one is just counterintuitive. Just know how to measure the basic things. But the biggest challenge was basically training people, teachers how to use an Android phone. The people who have not used an Android phone will take a little bit longer. The ones who have used it probably 2 hours, 3 hours,